The meeting will begin in about 3 minutes. The meeting will begin in about 1 minute. All right, Dr. Wayman, I have 2 o'clock, so we'll get started. Do you hear me okay? All right, sounds good. And you're muted in case now you're off mute. So let's start with an update. Let's see, as far as our total cases, we've had 18 or 1,814 total cases in Adair, 1,391 in Casey, 1,447 in Clinton, 679 in Cumberland, 1,200 in Greene, 1,968 in Macquarie, 6,233 in Pulaski, 1,831 in Russell, 2,982 in Taylor, 2,183 in Wayne, for a district-wide total of 21,728 cases. We currently have 145 active cases. That's as of last night. 21 folks hospitalized due to COVID-19. 124 on self-isolation. We've had a total of 388 deaths. Our mortality rate among known cases is 1.79%, or about 1 out of every 56 people who contract COVID-19 end up passing from it. We have, with having had 1,210 hospitalizations, that's a 5.57% hospitalization rate among known cases, or about 1 in 18 people. So a few other interesting pieces of information. When I looked at this a couple days ago, it may have changed a little bit. We have less than 0.5% of our cases are second infections. And of course, some of those first infections might have been a false positive or something on a test, but again, the percentage of people, regardless of the circumstances, who end up showing positive twice, it's very small. It's less than 0.5%. And as far as people who have had at least one vaccine who ends up coming down with COVID-19, so far for our districts, the numbers are somewhere between 0.6% and 1%, so less than 1% of people who've gotten vaccinated, at least with our local numbers, have ended up coming down with the disease. So it appears that if you've had it or if you've had the vaccine, in most instances, you're pretty secure of not getting it again, at least locally, according to what our numbers are showing right now. I know the virus changes and mutates, and that could change. As far as our new case rate, it seems like every day when I look at, this evening when I look at how many cases we had today compared to last Thursday, we'll see if we have more or less. And it seems like every day when I go back and look at the equivalent day for the previous week, it seems like every day that's shifting. One day we'll have a few more cases than the week before. The next day we'll have a few fewer cases than the week before. The next day a few more than the week before. The next day a few fewer. So we're kind of plateaued in our decline at this point. Having anywhere between 25 and 35 new cases a day. It's still the group that has the worst outcomes still tends to be the 60 and older as far as hospitalizations and deaths. But that being said, we do see the hospitalization average age, it is declining over time. And that's probably because, a lot of the elderly people in nursing homes and otherwise have went ahead and gotten the vaccine. So that would mean that they're more protected, and the people that are getting sick now just tend to be younger because we had a better uptake rate for the vaccine with the older population or the more elderly population. So I guess as far as other updates, Dr. Wayman's going to talk about Johnson & Johnson here in a few minutes, but I know that the CDC and the FDA decided to put Johnson & Johnson on hold for the moment. It's unfortunate, the timing of that. Of course, I want the vaccine to be safe, but it is unfortunate timing because we had, as far as our vaccination efforts, had moved through most of the population locally who were willing to get the vaccine, who were anxious to get it. And we were bumping up against a more reluctant segment of our population. And then with the J&J Johnson & Johnson vaccine being put on hold, I think that made the reluctancy even stronger. So we still need to reach the herd immunity, and we need to do that preferably through vaccinating people rather than the people coming down with the disease. So I guess that's all I've got as far as updates. Dr. Wayne, you want to add anything as far as just general updates?
Well, I was going to speak a bit about the Johnson & Johnson vaccine.
Well,
and the reason they were paused is because we had 6 cases of either cerebral or abdominal clotting in 6 women out of 7 million doses, obviously for both men and women. And these ladies were all between the ages of 18 and 48, so they're generally in the young. This is not unlike the AstraZeneca vaccine, so it is a very rare but serious probable side effect from the vaccine. It seems to occur 6 to 13 days after the vaccine and is some kind of immunological reaction. The FDA and the CDC paused because they really wanted to investigate. They wanted to be very cautious. The final verdict will come out this Friday, and I assume it'll be very similar to what was decided in Europe, which is to start using the vaccine again, because this is very, very rare. It's like being hit by lightning, possibly. So definitely the risks still are much less than the benefit. Of course, COVID disease also makes blood clots. So you have a lot more people who've had blood clots from COVID disease than you've had from the vaccine. Now, but the one thing that we want the public to know is if you have side effects within 1 to 2 weeks after the Johnson & Johnson that comprise of either severe headaches, blurred vision, chest pain or abdominal pain, or a rash, you should go to see your doctor immediately, because there are treatments and people need to be treated if that happens. But like I said, it is a very, very rare side effect.
Thank you for that update, Dr. Wayman, on the J&J. Again, it's just, there's nothing about this pandemic that's been easy, and getting folks vaccinated is not going to be easy either. There was a few weeks there where we had way more demand than we had supply, and now there's a surplus of vaccination at most of our vaccination sites in our district. So it's readily available. People should be able to go and get it. But you know, convincing a reluctant population to get it when, you know, this recall on the Johnson & Johnson, or not the recall, but the putting it on hold, it's not helped the matter. There's a question, or there was a question this week about some stories that has ran over the last few weeks showing some of the counties in our district having low vaccination rates. And I wanted to clarify that at least the last time I checked it, the way that the vaccination efforts are being tracked, they're being tracked by the county where the vaccine was given, not by the residents of the person that got vaccinated. So if you were someone from Casey County that went to Elizabethtown or Louisville to get vaccinated, the vaccination would show up at Louisville or Elizabethtown where you got vaccinated, not at your residence of Liberty or Casey County, or, you know, anywhere else in our district where you would have traveled out. It would have showed up where you traveled out to. So we suspect very strongly that a whole lot more people has gone outside of our district to get the vaccine than there has been people who have traveled from outside of our district inside to get it. So the best we can tell, our district is doing as good as any district in the state getting the population vaccinated. And you can look at the 7-day incidence rate chart on our website, or the whole, you know, we have it for our 10 counties, but you can look at it for every county in the state, and our district seems to be doing as well as the new case, as far as new case rate goes, doing as well as anywhere in the state. So I think we're on line with that. So if you are in one of the counties and you saw an article about your county, the vaccination rates are low there, just remember it can be skewed because like Casey County, for example, a lot of those folks would travel to Danville. And it's a pretty common thing in our district for people to travel out of their home county to get medical care. It's not uncommon at all. Folks in Cumberland and Clinton tend to go toward Glasgow and Bowling Green. Folks in Casey County tend to go to Danville. So, you know, it's just not uncommon for people in our district to travel a little bit to get medical care. So don't get too worried about that. But do please, if you you haven't been vaccinated, please do go get vaccinated. There's lots of providers. If you'll go to our website, we got every day you can just click the main COVID link, and at the bottom there's a whole list of providers, and it's got phone numbers or the links to the website where you can go and sign up. So please do get vaccinated. Let's see what questions we have. We do have some people listening in live. I will say, if you have anything you want to ask myself or Dr. Wayman, please type that into the chat box, and I'll try to watch that on our YouTube live channel and answer those questions if we can. We had a question about how effective was our efforts to bring COVID vaccination to our Black and Latino communities or citizens. So with our vaccination efforts, as you all know, the overall strategy in the beginning was to focus first on those in nursing homes and medical providers. That those populations have pretty well been taken care of, at least as insofar as the people in those populations who wanted to get the vaccine. And then right below that, we did the 70 and older, school personnel, and first responders. And those groups have pretty well been taken care of. And then we moved to the 60 and older, and then the 50 and older, and then to everyone as the vaccine started to become more available. And we've got a mobile unit, and we've started reaching out to factories and to churches and to leaderships, people who are leaders in the Hispanic or Latino communities and the Black communities. And in fact, right before the Johnson & Johnson vaccine got put on hold, we had just done a pretty significant vaccination effort with a pretty large Latino church or Hispanic church here in Pulaski, and we were beginning those efforts. Right now, though, nothing about this is easy. We had transitioned largely to Johnson & Johnson because we knew we were going to be going off-site more to give the vaccine to factories and churches and just other groups. And it was a real advantage only having to give one shot and not have to give that second shot. With Moderna or Pfizer, there's a prime dose and a booster dose. With Johnson & Johnson, there was one dose. So, when you travel off site, you're already less efficient. One nurse in the clinic could vaccinate between 40 and 50 people a day. When we go off site, there's travel time, there's setup time, and all those other factors that go in. And if you're going to if you're going off site, you never know when you set up off site for the follow-up clinic how good your return rate will be for the boost doses. So our strategy of going off site was really focused around using the Johnson & Johnson one dose vaccine. So now we're kind of on hold till Friday to see what the judgment is going to be from the FDA and the CDC about the vaccine. After this Friday, depending on what gets decided, we will reassess our outreach strategy. So, for the last week and a half, we've really kind of just been waiting to see what happens with the Johnson & Johnson. And once we get the determination on that, if we have to do the 2-dose offsite clinics with Moderna, we will. We would rather do the Johnson & Johnson. We'll just see how this turns out. But we'll be reaching out to everybody in the communities that we can possibly reach out to. We want to certainly the American community in our district too, and we'll be making every effort to do that. Dr. William, you want to add anything to that?
No, I think we're good. I just want to make a point about vaccination, that to get this herd immunity, we need to get to at least 60% of the population. And that's been shown in 2 countries, the UK and Israel, where they've actually immunized 60% of their adult population. And their numbers have plummeted, as have their deaths. So we have examples where vaccination really helps. So we just need to keep going until we get at least to that 60%. Obviously 85 is better, but 60% seems to be doing the trick.
Let's hope we get there soon. There's nobody, that wants life to move on past COVID-19 any more than public health. It's been a lot of work for us. And I know it's been difficult on everybody. I know it's been difficult on businesses and difficult on schools and just difficult on everybody in a wide variety of ways. And we all want to get back to normal. I know the governor has set the threshold if we can get up, was it 2 or 2.5 million? Do you remember, Dr. Williams?
2.5 million
vaccination, at least first
in
dose.
Kentucky, yes.
Yeah, and we were over 1.5 million, I think. So.
Will you please call 1156 Angie the Cracklet?
I'm sorry, that was my phone. PA. So there's enough vaccine where that could be achieved pretty quick, but we're also at a place where we're dealing with a more reluctant part of our population to get the vaccine. So I'm certainly hoping that we reach that goal and that most of the restrictions are lifted, and that'll be fantastic. Another question. A few weeks ago, the health district announced receiving a van to use for mobile COVID-19 vaccine clinics. Do you know if that is being used in the 10 counties anywhere, and are there plans, to have it in Macquarie County? We plan to use it in any county where there's a population of a group of people that's willing to get vaccinated as we get vaccine. We have used it several times already. Yes, we've used it with mostly with large manufacturers, but we've done some residential locations too. And again, now we're just kind of stuck with waiting on the decision with the Johnson & Johnson to kind of figure out what to schedule next. We do have a list of a few places that have reached out to us that want us to come, and we're more than happy to do that just as quick as we figure out what vaccine we're going to have available to us, and whether it's the Johnson & Johnson or Moderna. Because if it ends up having to be Moderna, you have to plan the follow-up clinic 4 weeks later. So again, we're kind of just waiting on Friday to keep moving with that. And as I said earlier, we do plan to reach out to every group, and we have been already reaching out to every large group that we know of, factories and large churches, and we're going to continue to do that as our resources allow us to do that. Of course, we still got we may have more vaccine than we have resources as far as human resources. We still have a limited number of staff, and we can only go so fast. But that being said, there are plenty of opportunities to get vaccinated in our communities. Don't wait for us to drive the van up. Go to the pharmacy, go to the FQHC, come to the health department. We schedule a visit through the health department. Lots of places. There's Kroger's and Walmart's and all sorts of places. So plenty of vaccine opportunities. Let's see. I don't have any other questions, Dr. Wayman, this week. Do you have anything left on your list?
No, I don't.
I'm going to give the folks that's listening in live on YouTube the opportunity to type one last opportunity to type a question in the chat, and we're about a 20-second delay, so I'll stall for about 20 seconds to see if a question pops through. We are certainly glad to see the numbers going down. There was a fear at one point, at least by me, that as the schools got ramped back up and going more in person, that we might have another spike, and so far that's not played out. So I'm thankful to be wrong about that, grateful to be wrong about that. Maybe there's not as many kids in school as we thought there would be. I know the schools are working really, really hard to keep things safe for everyone, or as safe as possible. So between their efforts and the vaccine of the teachers and so forth, school staff, that hasn't played out. So that's been good. Let's see. We do have a question. Judge Green says, "You seem really relaxed, Sean. Are you going to be retiring or something?" Yeah, that is true. Judge Green, if it would have been financially advantageous for me to have retired last August, and that was originally my intention, was to retire last August, but COVID had started, and we knew it was going to be a major public health event. And I've been the director for 20 years. We've been through H1N1, swine flu, hepatitis A. We've done incident command and structure here, and I felt bad about dropping the health department director's job right in the middle of the public health event of our lifetime, and dropping that on someone new. So I ended up staying an extra year. But it's been challenging in a lot of ways, but this is what that we're trained to do, and we were happy to do it. And the staff, even though it's been a lot of hours and a lot of stress, the only employees that we lost through this process was just right at the very beginning, when I was telling my employees you're going to have to work some evenings and weekends, there was just 2 or 3 that said we can't possibly do that, and went ahead and resigned. But basically, we've just worked our way through it. And it's more relaxing now, Judge, because it just is more relaxing now. The cases are going down. There's plenty of vaccine around. So, there's more things to be positive about, less things to be mad about. But having a retirement coming up in August, that will relax you some. Let's see, we've got a couple more. Judge Green said, glad you stayed on. You and the whole staff have done a great job. Well, we appreciate that. I know it's been hard. We've been put in a controversial position and did the best we could to try to be as fair and do the right thing as far as public health goes. Let's see. Wanda wrote, if you receive J&J vaccine and it is determined that a vaccine is required every year, like the flu shot, is it then safe to take the Moderna if you choose not to take the J&J again? So I think the question is, if it ended up being a annual vaccine, Dr. Wayman, could you go from one brand to another brand safely?
Well, those studies are out right now for actually mixing and matching vaccines as a first and second dose. So, and the preliminary studies look very good. In fact, they may give you a better immune response than if you use the same vaccine. So I don't see any reason why you couldn't have a different vaccine a year later.
Yeah, and we've talked about this off and on too, and you might want to just mention it again. If the virus does mutate enough to where it starts,
The
being
vaccine.
resistant to the vaccine, that it won't be like we're starting from scratch, because the manufacturers of the vaccines now have a process in place to develop this and get it out quickly. So you want to mention that?
Well, exactly, they are. They're currently actually doing a trial on the other strains, the Brazilian one or South African, because they're the ones that escape the effect of the vaccine. However, the vaccines still work to some degree, and they certainly prevent severe disease, even if they don't prevent infection from those different strains. But yes, they are working on them now, so I suspect by the end of the year, we'll have another vaccine should we need it.
So the world is more aware of coronavirus in general now, regardless of which one it is, and they're looking at it more closely. When the COVID-19 virus, when it made the jump from animals to humans, it was novel, it was new. No one was ready for it. Now, several years ago, there was another coronavirus, and it kind of came and went, and the various countries in the world and drug companies and things, the governments, they just kind of abandon things, but they're not abandoning this. This is a worldwide pandemic, and they're on it. So we wouldn't be starting from scratch. I hope everyone understands that. It probably wouldn't lead to these mass worldwide shutdowns and stuff again. It would just be a vaccine will be developed. It'd be developed and put out pretty quick. So try not to worry about that. I have that question asked to me pretty frequently, so thought we would talk about it again. All right, I don't see any other questions. Dr. Wayman, you have any final good words for us?
I would just like to let all the people who are hesitant about vaccinations with specific questions to actually send them to us so we can reply.
And certainly, please take the vaccine. There's plenty of vaccine available in our communities right now. There's a few places that have Pfizer. Most of them have Moderna, and there's a good amount of Johnson & Johnson that's in refrigerators right now waiting for the FDA and the CDC to say, give it. So we'll see what they say Friday. So thank you all very much for tuning in. We appreciate you. We'll do this again in a couple weeks. Let's see what date that will be. Today's the 21st, so that would be on May the 5th will be the next time that we do this. If you want to put it on your calendar. So again, thank you all for tuning in, and we'll